back type of scoliosis, where they're getting a little hump in the back there, you know, and then your neck, the neck juts out forward, and the chest kind of comes in a bit, you know. So you have a, what you call pigeon chest, you know, like a chest like a pigeon is popped up, and then the whole structure of how they sit, you start looking, that's one of the things you determine when you start seeing kids sit a certain way and they're slouching. And you say, Johnny, sit up in the chair, and they sit up straight. In 10 seconds, you look back and they're back into the position. So what is happening is their spine is developing in a way that allows them to sit that way. It's not that that's bad posture. It's just that the spine is developing in which they go into slouches, they go into various
advice do you have for the ministry? Because you're looking at this and they're saying 15% of the body weight, which according to you would be about no more than 8 to 9 pounds.
Right.
But you have instances in primary school and even secondary school where you have these tiny little children with these book bags that are probably twice their size. How do we, the ministry says that teachers are not putting the timetable right, that they're just not doing it. But children will walk with their books. If I have homework to do for a class, I'm going to walk with the books.
Well, that's the thing. I think what we have to, the whole dynamic has to change. And it's going to take a lot of will to change it. Now, one, you could say, well, the trolley bags and adjust the bag system where you strap the bags a little lower and make it more brief. The child. But I think the future really lies in the laptops. You know, I have a granddaughter and she goes to the Canadian school and they don't have any books. They do everything on their laptop. Right? So the books now are on the laptops, everything is done. So I think the future really, if the ministry wants to move in a direction, is they need to get these kids and their laptops and get the school working more in that direction.
Okay,
and that's going to take quite a bit.
That's going to take quite a bit. I mean, God knows we took 4 years to change the syllabus, so we know how we're going to go with it.
But the trolley bags are one way.
Right, because I wanted to ask, what are the options? Because you have children who have to carry these books. So I know in my days, I would always have like half of my books in my hands because I was always conscious of my posture. Or there are those with the trolley bag. So what do parents need to do?
So I would think we should go back to some of these bags where the kids switch it from side to side. You know, it's difficult.
Well, is it not easier to carry it with both straps on? I mean, and now bags are now back in style.
Well, that's the thing. There's no quick answer to the whole thing, because what has to be done, and this is one of the things I want to stress with parents, if you see your child developing a curve, let's say, right? Now, the trolley bags are effective, but again, when they have to lug those things up the stairs, so you have to take all those things into consideration. So that's one thing. The type of bag, because there are those bags you could strap and kind of brace the child's back. But again, you're looking at the weight, the amount of books. So one of the things that has to be addressed, again, is the syllabus and the kind of regulating the type of books and how the books the child carries.
Now, Dr. Smith, we're talking about a chiropractor. So when you see the curvature, when is it that parents, because they're the extreme where there needs to be corrective surgery, where you go to a spinal surgeon and you say, I need my child's back to be, or those who are wearing a brace, where you need. So when you see that developing, what are some of the warning signs? What are some of the preventative things you can do? What are some of the corrective things you can do?
Right. Well, I'm going to give a little kind of initial screening where parents could look at their kids. First off, you stand your kid up and as straight as possible. You look at the shoulder levels. Then you go down. So if one shoulder is higher than the other, then you know that this child is starting to develop a curve. Then you go down to the shoulder blade levels. At the tip of the shoulder blades, you go down there, you put your fingers, and you look at that level. Then you go down to the hip level where you have two dimples there in the hips. You look at if one is higher than the other. And then back of the knees where you see those lines, if the lines aren't lining up properly. So right there, you kind of get an initial screening. This kid is developing a scoliosis. Now, what do? It's something that, first off, you have to get a screening, get some x-rays done. Now, these scoliosis, your growth rate is from 0 to 18 years. When you reach 18, most of your bone development has been completed, ossification center and whatnot. So within the first, from about 8 to 16, that's when the growth spurt is happening. You find that people begin to have, you start to see the curve, especially in girls. You see a development where it starts, all of a sudden you see a disfiguring. So that's why you have to keep looking at them and checking them. From the minute you know that it's happening, you have to get some type of correction. Now, scoliosis, remember these children are developing, so you can influence the development.
Right.
And that is where the treatment lies before it gets, now these things go in degrees.
Right. So what is a spinal tap? Because I've heard of people getting the spinal tap and then one wearing a brace, seeing if it's fixed, and if not, you have to go to a spinal tap.
So these things goes to degrees.
Right.
So between 8 and 12 degrees is considered quote unquote normal. Right? Anytime you start going up after 12 degrees, then you have to start looking at it seriously. When you reach 40 degrees now, 40 or 45 degrees, that's when people start considering the operation where you do a spinal operation, where they put in a thing called Harrington rods to kind of stabilize the spine from curving any further. So you want to take it, once it's under 40 degrees, it can be treated effectively and managed properly. In the younger children, I would say from anywhere from 4 to 12, 13, 14 years, you can have correction. So you can get some straightened based on the program that you enter. From 12 to 16, 18, what you want to do is pretty much stop it from progressing. So you want, when you reach 18, you're set in stone. What you have is what you have. So there's no more major development after 18 until you reach probably, women, especially with women, after menopause, you start having curvature issues, you know? So you would probably have that. But it can be corrected. That's why you can't be, it's not something to be scared. Don't let it go to where your child continuing to get more and more of a curvature where you'd have to take an operation. That's the last resort. Now the braces, at a point, the braces don't work. You know,
when it goes beyond the 45 degrees?
That's right.
Okay.
So you want to use, and then you have to be really diligent and pretty much how you use the brace and using a brace, because sometimes using a brace is like they say, if you don't use it, you lose it. So if you put on a brace, sometimes your muscle structure, all those things don't develop as it should. You get atrophy and you become weaker. So all these things have to be considered in a discussion. And there's a full program that one can follow to develop and get scoliosis managed properly.
Your advice to parents out there, because there's a lot of, I mean, sometimes I see these little tiny children, I'm like, oh my God, they're going to topple over with this bag. Right. So what do you do? What advice do you have for parents out there?
Well, I would say you have to monitor your children. One, look at them every day. These things progress sometimes very quickly. You have to manage the book situation. If the ministry doesn't manage it, you have to, or the school doesn't manage it, you have to try to manage it, and as much as you can reduce the level of the books being taken to school. And 3, they utilize the various options you have. You could switch between the trolley bags. Always make sure that the strap, when you strap in the backpack, you have a good strap under where the rib area is. So it kind of braces them also. Yeah? So
when you're buying your bag, don't just look for the most stylish like I used to do. Get a practical bag and make sure and have a strap around the waist so it kind of evens the distribution out. If you also can get the trolley bag, that's going to be the best for you, and move it around as well so you don't just lean on one side. And
I suggest you always monitor. If you take these things up early, there can be correction.
So if you need medical advice from a year of chiropractors, you also have medical doctors. If you are convinced that there is a serious medical problem, that your child is developing, is experiencing levels of pain, that curve has gone beyond 45 degrees, definitely seek medical attention. There are specialists who look at the spine itself. So, Doc, thanks so much for joining us.
Thank you for having me.
We take a short break. When we come back, we'll have more for you. Stay with us. This is The Morning Brew.